Hello, I am Dorothy Henderson doing a presentation for Grand Canyon University course, Assessment, Eligibility, and Transition Planning. Children don't just come to school ready and able to read and write. They must be taught. And to understand what students require to learn, educators must focus on concepts of no child left behind, such as the special educator, the teacher, and other school professionals. The timeline required for IED A and those general rules are very important to the understanding of the typical development and assessments used in an educational evaluation. Before that referral typically starts, the general educator in interventions such as response to intervention or multi-system of support that addresses the academic and or behavior concerns. If the child does not respond to adequate progress, a formal referral must be submitted. That submission should come from and must come from the parent. So a quick glance process, we will see students could be placed in a tier 1, tier 2, or tier 3 category. In the classroom, that would mean a tier 1 core instruction. All students receive high quality reading instruction. Families can read daily to the child. That's a tier 1 expectation. A tier 2, targeted support, such as small group reading support, small group math, small group science. Families can practice skill set at home, sent home. Tier 3, intensive support, individual support, individualized reading, for example. Families can help by staying close to the teacher. We're looking at the timeline now. From the date of parental consent, once that is given, the school has 60 calendar days or the state timeline, depending on the state, to complete the evaluation. The final eligibility consideration is meeting is held to determine, so that determination to qualify the student for special education services. For those individualized education program, which is an IEP, must be developed within 30 days of that determination by the special education department, working with either the general teacher, a specialist set for that particular school, and the parent, given that they have looked at assessments and informal assessments. So after the IEP is finished, services then will begin as soon as possible. So it's very typical to consider the cognitive and other factors such as the home environment, normal development. True educational disabilities depend on the evaluation of distinguishing the true problem, be it cognitive development or true education. The typical development is considering developmental milestones in cognition, language, behavior, and social skills. These provide a baseline for comparison. Therefore, to conclude, when comparisons are done and considerations are considered to be cognitive, limited education, environmental, or generics, the school has 100% way to correctly process, which means they ensure students receive appropriate educational support. Thank you for watching.